I'm Dr. Carter Singh. I'm the Chairman of the Nottinghamshire Local Medical Committee. We've seen an increase in the number of complaints that we've received from patients in the last few months. We've also seen an increase in the levels of violence and threatening behaviour and abuse that our staff and doctors experience in general practice. Contrary to what you may have seen in television or read in the newspapers, your GP practice has been open throughout the pandemic. Has it been business as usual? No, it hasn't. It hasn't been business as usual in any sector of business, including leisure, aviation, education. They've all been turned upside down. We've had to make some difficult choices during the pandemic and necessary changes to the way we work to ensure that we keep our patients safe and protect our staff and doctors. You may have noticed things are working differently in general practice, including the type of consultations you may have been offered, and the way you can contact your GP may be different to what you're used to. We understand that change can be unsettling, especially when everything else around you may be changing too, including your children's education, your work life, your income, and also having to deal with the tragic deaths of friends and family members due to the coronavirus pandemic. It's an extremely difficult time for us too in general practice. We've been very busy delivering the lion's share of the biggest ever vaccination programme in history, at the same time as having to deal with all of the usual health concerns in non-pandemic times. We ourselves have also had high rates of sick leave, and our practice staff and our doctors have had to self-isolate, and some have even contracted COVID, just like everyone else in society. This has caused additional pressure for appointments and access for our patients. The amount of workload in general practice has never been higher. Record numbers of GPs are considering leaving the profession due to stress and burnout, so the demands of general practice become ever more insurmountable for the dwindling remaining GP workforce. GPs and patients are natural allies, and we are all working for the same common goals of ensuring that we keep you and your family safe, well and healthy. So we ask for your patience and understanding in working collaboratively with us so that we can work towards this common goal during the difficult and challenging times of the pandemic, and also moving forwards beyond the pandemic into the future. Thank you so much.